this is adult assessment, so the first thing I'm going to do is I'm going to gather my supplies. So my pencil, my blank piece of paper, and then my clipboard to write down vital signs. So now I'm going to go on over and into the patient's room. Knock, knock.
Hello.
Hi, I'm Amanda. I'm going to be your nursing student for today. I perform hand hygiene. Can you please tell me your name and date of
Roy
birth?
Bender, 11/13/60.
Okay, are you allergic to anything?
No, I'm not.
Okay, that's my privacy. So your doctor has ordered for, I'm going to conduct a head to toe assessment on you. A head to toe assessment is when I have to look at every part of your body to detect medical abnormalities that may need further medical intervention. Do you have any questions?
No questions.
Okay. Before I begin, do you have any cultural or spiritual beliefs that could impact my care?
No.
Okay. Can you tell me about your relationships and how you've been feeling emotionally?
I have good relationships. I feel good emotionally.
Okay, that sounds good. Now I'm going to grab a set of vitals. So, okay. His blood pressure was 110/60. Okay, I'm gonna put this pulse oximeter on you. It just measures your temperature, not your temperature, your oxygen saturation and your pulse. I'm gonna take your temperature. It's gonna go on your head. Okay. 96. So I'm gonna get a temp, a blood pressure, a pulse, a pain assessment, a respiratory rate, and it's oxygen saturation. Okay. So respirations were 18, oxygen was 90, and pulse was 62. Can you rate your pain on a scale of 0 to 10, 10 being most pain, 0 being no pain?
0.
0. Okay. Okay. So now I'm gonna ask you some silly questions, but they do have a purpose. Can you tell me who you are?
Roy Bender,
Can you tell me where you are?
in the hospital.
Can you tell me what time it is?
It's so afternoon.
Alright, what's the situation going on?
I'm here to have your patient assessment done.
Okay, so based on his answers to my question, I can say that he's conscious, alert, oriented to person, place, time, and event. He was willingly able to follow my commands because he answered my questions. His speech was not slurred and his tone was monotone. His mood is calm, and the effect is him relaxing in bed. And his auditory acuity, he can hear me speaking at a moderate tone of voice. So my general impression of him is that he's sitting up in the bed. He doesn't have any poor body odors coming from his mouth or his body. He is wearing clothes that are appropriate for the weather. he is positioned in a relaxing state. His overall appearance is that he is well groomed. So now I'm gonna go ahead and start the hands-on assessment. So I'm gonna palpate you, and if you're uncomfortable or if you feel pain or if you're tender, please let me know.
I will.
Okay. So I'm looking at his head. I'm going to inspect for deformities and tenderness. Alright, let's lift up your head. So I don't feel any deformities. His hair is even in distribution without any infestations. His head is symmetrical, and the size is proportional to his body, and it's symmetrical, size is proportional to the body, and the shape, there's no deformities, is normocephalic. So now I'm looking at his face. So can you stick out your tongue? Can you smile real big? So his face is symmetrical. He has full range of motion with his facial movements, and the face functions appropriately to my commands. He does not have any deficits. So I'm gonna palpate your sinuses. Were those tender?
Yeah.
Tender and non-tender and non-swollen sinuses. His overall appearance, his skin is clean, dry, and intact, and he's not in distress, and his skin color is appropriate for his ethnicity. Now I'm going to look at his eyes. So I'm looking at all parts of the eyes. So his eyelids are not swollen, his sclera is white, his conjunctiva is pink, and his pupils, can you remain your eyes? Thank you for keeping them open. There's no strabismus or nystagmus present, and I'm going to assess your pupils. Your pupils are equal, round, and reactive to light. I'm going to have you focus on this and on something behind. So equal, round, and reactive to light in the combinations his pupils are. And have you had any vision changes at all?
No.
No? Okay. Do you have any problems with your vision? No? Okay. So I'm looking at his nose. His nose is symmetrical. There's no lesions. The skin integrity is clean, dry, and intact. I am now going to assess his nair patency. So I'm going to include one of your nairs. Have you breathe in, and that will just help me detect if you have any problems or like adverse airflow coming from your nair.
Okay.
Right, breathe in. Okay, breathe in. Okay, so his airways were patent in his nairs. Okay, so now I'm going to assess your ears. So if you look that way, please. So your skin integrity is clean, dry, and intact, and the color is appropriate for his ethnicity. I'm going to palpate for tenderness and lumps. Are you tender?
No.
Alright, no lumps present, and now I'm going to assess for the drainage. Okay. No drainage present. Now can you turn over? Thank you. So the skin is clean, dry, and intact, no lesions, and the color is appropriate for his ethnicity. I'm going to palpate for tenderness and lumps. Is that tender? No tenderness, no lumps. Now I'm going to assess the drainage. There's no drainage coming from his ear. So now I'm going to look inside of your mouth. Have you had any problems with your ears?
No.
Okay. So I'm looking at your mouth. His lips are moisturized and pink. So can you open up? So his mouth is moisturized. The uvula is in line. The color is pink. His dentition is adequate. He doesn't have any missing teeth, and no tar coming from the teeth. The uvula's midline. His mouth is moisturized. Do you have any dentures?
No.
Okay. So now I'm going to inspect his neck. So I see that his trachea is midline, and he has no JVB present. I do not see any enlarged lymph nodes, Gaudier, or masses, or swelling of his lymph nodes. I'm going to palpate now. So. tender or painful?
No.
Alright, no mass is present. His lymph nodes are not swollen. So I'm gonna have you turn your head towards your right and look up. I'm gonna palpate his carotid. Carotid is present in 2+, non-thready. And there's no JVD present. Alright, you can look the other way now. Carotid is present, 2+, non-thready. No JVD present. Your lymph nodes are not swollen. There's no Gaudier or masses. Okay, were you tender at all?
No.
No, okay. His skin integrity was clean, dry, and intact and appropriate for his ethnicity. The color was. No lesions present. So now I'm going to assess his upper arm. So first I'm going to inspect. So his skin integrity is clean, dry, and intact. No lesions. His color is appropriate for his ethnicity. So skin color, clean, dry, and intact, appropriate for his ethnicity. While his skin integrity was clean, dry, and intact, the color is appropriate for ethnicity. So now I am going to do his circulation. So I'm going to palpate bilateral radial pulses. So they're both equal and in strength, 2+. One's not irregular. So now I'm going to assess his capillary refill. Capillary refill is less than 3 seconds. His temperature is warm. His joints are not swollen. Capillary refill is less than 3 seconds. His skin temperature is warm and his knuckles are not swollen and there's no presence of lesions. Now I am going to assess his motor function. You can squeeze my hands. Okay, equal grip strength. I'm going to have you go like that. Fine motor skills have no deficits. Now I'm going to have you sit up. And I am going to have you go like this. Are you experiencing any pain?
No.
Okay, that's good. So we have full range of motion, and now I'm going to palpate his arms. His muscles are equal in size and symmetry. Are you tender?
No.
Okay, no swelling present. Now I'm going to palpate. Okay, no masses present or swelling. Were you tender?
No.
There were no masses or swelling on that arm either. So, sensory, I'm going to have you close your eyes. You're going to touch one of my I'm going to touch one of your fingers. You can tell me which one I'm touching.
Pointer.
Okay, good job. So now I'm going to assess your back. Okay. So I'm looking at the skin integrity on his back. His skin is clean, dry, and intact. His spine is within midline. His temperature is warm. Do you have any problems with your back?
No, no.
No? Okay. So now I am going to palpate for tenderness. Is that tender?
No.
Non-tender and no palpable masses present. So, have you had any problem with moving your arms?
No.
Okay. So now I'm going to do your chest, so you can go ahead and lay back down. Okay, so I'm looking at the skin integrity on his chest. His chest is clean, dry, and intact. The skin color is appropriate for ethnicity. He does not have a port or a pacemaker. His breathing is symmetrical, non-labored, and equal chest rise and fall. He's not in distress. He doesn't have retractions. His posture, he is upright. So now I am going to assess your heart sounds. After this, I will do your lung sounds. So aortic at second intercostal space. Pulmonic, second intercostal space left side, and aortic was on the right side. Herb's point, third intercostal space left side. Tricuspid, fourth intercostal space left side. last one, and S2 present, heart sounds were not muffled, so now I'm gonna listen to your lungs, so can you sit up, please? Thank you. So now I am going to listen to your lungs. Lung sounds were cleared bilaterally in the interior aspects at 3 points. 3 lobes? Or 2 lobes? 1. Okay. Sounds were clear bilaterally on the posterior aspect. So, have you had any chest pain or shortness of breath?
No.
Have you had any problems related to your breathing or your heart?
No.
Okay. So now you can lay back down. I'm going to do your abdominal assessment. So I'm going to look at the skin integrity. The skin is clean, dry, and intact. There are no deformities on his abdomen. The contour is not deformed. His skin is clean, dry, and intact, and the color is appropriate for his ethnicity. Okay, so now I am going to auscultate, starting in the right lower quadrant. There were active bowel sounds in all 4 quadrants. When I auscultate, it would be preferred if I put my stethoscope to the skin, but since he's uncomfortable with that, I compromised and I did it over his t-shirt. So his temperature on his arms is warm. So now I am going to palpate. Let me know if you're tender or if you have any pain.
Okay.
Not painful?
No tender, no pain.
Okay. So he had no distension and no rigidity, so now I'm gonna palpate the bladder. Is that tender or painful?
No.
No? Okay. His bladder was not distended. So have you had any troubles with your bowel movements?
No.
Can you tell me how they look?
Round and solid.
Okay. Have you been voiding regularly?
Yes.
Okay. So now I'm going to do a GU assessment. So have you had any pain while you void or
No.
do you have any concerns?
No.
Okay, so now I'm going to go ahead and I am going to do the GU assessment. So now I am going to do the GU assessment. So I'm looking at his skin integrity and I'm looking for foul odors. So the skin looks clean, dry, and intact. The color is appropriate for his ethnicity. I don't see any lesions, and there are no parasites present. There are no foul odors as well. I'm going to turn you 1, 2, 3. So I'm looking at his coccyx, his lower back, his perineum, and his buttocks. There are no parasites. His skin is clean, dry, and intact, and appropriate. The color is appropriate for ethnicity. There's no signs of trauma like deformities or contusions. No parasites. And yeah, I'm gonna put you back down. Go. Okay, so I already gathered my subjective data on the GU assessment, so now I am going to do his lower extremities. So I am going to first inspect his skin. Okay. So his skin looks clean, intact and dry. His temperature is warm. Clean, intact and dry. His temperature is warm. The skin color is appropriate for ethnicity. Now I'm going to assess his circulation. So I am going to assess his pedal pulses. They're equal and 2 plus. Then posterior tibial, equal and 2 plus. Now I'm going to do the capillary refill. So his capillary refill was less than 3 seconds. Capillary refill less than 2 seconds. His toenails are not clubbed and they're well maintained. He doesn't have any swelling on his toes or anything like that. His temperature is warm. Now assess your motor. Can you kick your feet like a bicycle? Okay, wiggle your toes. So gross and fine motor skills present. I'm gonna have you lift up, push down, equal strength bilaterally. And now I am going to do sensory. So I'm gonna have you close your eyes, and I am going to touch a toe. You can
Big
tell me which one.
toes.
Big toe. Okay. Now I'm gonna palpate. I'm palpating for masses and tenderness. Are you tender?
No.
No masses, no tenderness present. I'm gonna assess for pitting edema. There's no pitting edema. Now I'm going to palpate. So no tenderness.
No.
No tenderness. No masses present. I'm gonna assess for pitting edema. No edema is present. Okay. I am now going to assess temperature with my gloves off. Okay, no, it's warm. So now I'm gonna have you sit up, and I am going to have you walk. So here are your shoes, your non-slip shoes. So do you have any pain with your range of motion at all?
Yeah.
No? Okay. You walk there and then you can sit back down. Having any pain? Do you have any problems with walking? Are your shoes fitting okay?
Yeah.
Okay. You can go ahead and lay that down. So do you have any concerns
No
with your
concerns.
health? Okay. So his walk was independent. Yeah. I am going to make sure the bed is in the lowest position. You have your call line within reach. Here you go. Let me know if you need anything. Bedlock is on. Bedlock is on. Okay. Your bedside table is going to be within reach. Okay. Are you comfortable?
Yes, I am.
Okay. I'm going to sanitize my hands before I leave the room. Gather my supplies. And now I'm going to document everything I did and my skills complete.